Welcome everyone to this month's webinar in the EPA NIEHS Children's Center's 2013 webinar series. We are happy that you're able to join us today. This is Rich Callan from EPA's National Center for Environmental Research.
And this is Nika Louie, also from the National Center for Environmental Research. We jointly manage the Children's Centers for EPA with our colleagues at NIEHS, Kimberly Gray, Cindy Lola, and Claudia Thompson. We're excited to launch our 2013 webinar series today. The speakers and topics for the entire series have been posted on our website. Please register.
In today's webinar, we're pleased to focus on the important role of community engagement in the Children's Centers program. We have with us today representatives from 5 of the EPA NIEHS Children's Centers: the UC Berkeley Buffalo Center, Columbia University Center, UC Berkeley Eskenazi Center, UCSF, and Brown University Children's Centers. The first hour of the webinar will feature the presentations, followed by approximately 30 minutes for questions and answers.
Since there are many participants joining us, and to ensure a successful webinar, here are some ground rules. All lines have been centrally muted. Please also use the mute button on your phone and do not place a call on hold to avoid background music that may play when calls are on hold. Please turn off all webcams. The speed at which you'll see the slides change depends on your particular internet connection and computer capabilities. Please submit all questions for the speakers using the chat feature in WebEx. These will be compiled and the presenters will address as many questions as possible following all presentations. To access the chat feature, please scroll at the top of your screen. This will expand the box, then click on Chat, and a box will appear on the right-hand side of your screen. Please submit your questions to the host, Susie Warner, throughout the presentations. The webinar is being recorded and is expected to be available on the EPA Children's Centers website within the next month.
The mission of the EPA and NIEHS Children's Centers program is to promote the health and well-being of children, reduce children's health risks from environmental threats, and translate findings into intervention and prevention strategies. More than 30 Children's Center grants have been issued to date, and 14 Children's Centers are currently funded. There have been many important findings from these centers, and some are listed on this slide. That includes that near-road exposure to freeway traffic increases a child's risk of developing asthma, that prenatal exposure to some pesticides and the air pollutant polycyclic aromatic hydrocarbons, or PAHs, may lower a child's IQ, and that taking prenatal vitamins may lower the risk of autism.
Today we will be focusing on community engagement and the Children's Centers. Community engagement is a required and integral component of Children's Centers program, and most centers have a community outreach and translation core. The objective of the COTCs is to translate research findings into sustainable strategies to reduce environmental exposures to children and thereby reduce the incidence of environmentally related childhood diseases. On the left side of this slide are examples of outreach materials prepared by the Columbia and Mount Sinai Children's Centers. The pictures on the right are from the UC Berkeley Eskenazi and the University of Washington Children's Centers, which show how these centers engage communities to expand understanding on how to prevent harmful exposures.
At this point, we'd like to provide a short introduction for each of our speakers, and you can read their full bios on our website. Amy Kyle will be our first presenter. She leads the Community Outreach and Translation Core at the Circle Children's Center at UC Berkeley. She's Associate Research Professor at the UC Berkeley School of Public Health and Director of the Research Translation Core for the UC Berkeley Superfund Basic Research Program. She was recently appointed Associate Director of the Institute for the Environment. Our second speaker, Alyssa Crichton, is the Program Coordinator for the Community Outreach and Translation Core at the Columbia Center for Children's Environmental Health. She has an MPH in Environmental Health Policy from Columbia University.
Daniel Madrigal is our third speaker. Daniel is the Community Outreach Coordinator for the Center for Environmental Research and Children's Health at UC Berkeley. The keystone project at this center is Chamacos, a longitudinal birth cohort study in a Latino farm worker community in the Salinas Valley, California. Daniel coordinates the Chamacos Youth Community Council and other programs to engage youth in environmental health research. Our fourth presenter, Patrice Sutton, leads the clinical outreach and translation efforts at the Program on Reproductive Health and the Environment at the Children's Center at UC San Francisco. She has over 25 years of experience in occupational and environmental health research, industrial hygiene, public health practice, policy development, and community-based advocacy.
And our final presenter for today's webinar will be Phil Brown. He's the University Distinguished Professor of Sociology and Health Sciences at Northeastern University in Boston and directs the Community Outreach and Translation Core of the Children's Center at Brown University. He also directs the Community Engagement Core of the Brown Superfund Research Program. His most recent book is Contested Illnesses, Citizens, Science, and Health Social Movements. So first today we will hear from Amy Kyle from the UC Berkeley Buffler Center. Her presentation is entitled Aligning the Planets, Working with Networks to Achieve Structural Change. Professor Kyle?
Good morning, everyone, or I guess it's afternoon for some of you, or many of you. I'm really delighted to be part of this, and I thank you, Rich and Nika, for all your work to put it together. So I work with the Children's Environmental Health Center at Berkeley that works on childhood leukemia, which is a relatively rare disease. And so our studies focus immediately at our center on California as a whole, and we're connected to people who are doing work on leukemia around the world. And so our sense of our community and our people that we work with is not limited to one specific community that you might define in a town or by zip code or something like that, but a much broader network of people who are interested in leukemia, of course, the parents whose children are afflicted by the disease, and the larger children's environmental health community. So I'm going to talk a little bit about some of the approaches we've taken to dealing with that today. So my themes for this morning are to talk a little bit about the scope of what children's environmental health is, the different scales at which we work, how we're thinking about trying to amplify our common messages across this work, how we're trying to connect more broadly, and then identify points of uptake of our information into policy processes and policy audience. So I know we know this already, but there are many topics that are relevant to children's environmental health, and I have some pictures here about some that are relevant to our work. But my point here is that the scope of what we're working on is very broad and encompassing, and to try to deal with the interventions and policies needed to protect children, there are a lot of things that need to be changed or evolved or improved. And I think it has global implications. You know, we have issues in the United States. There are different issues in many developing countries. But as a world community, we're yet to really face the challenges and the implications of a lot of this research. And I'm showing you a map that shows only the cooperating leukemia centers that are part of our international collaborative. So that's what these various numbers represent here. But I just want to say we're cognizant of the world as part of what we need to be working in. So part of how we're thinking about this is that synthesizing our messages and our findings at a level that conveys some confidence and some clarity about what we know works. And we think that's a very important thing to focus on. So we're trying to do that. We're trying to use plain language. We're putting a lot of effort into trying to link across various groups engaged with children's environmental health. And I'm showing you the logos of the organizations that participated in an event that we had in January, which I'm going to mention in just a minute. But trying to emphasize where we agree and pull out our higher order messages that are relevant on a scale beyond our individual studies, I think, is a next step for this work and something that we're, as I mentioned, trying to work on here. Another aspect of this is to move ourselves out onto the public platforms and formats that people are using now. And the world is moving a lot to video. You know, I think it's partly because of tablets and devices and phones, but learning to use video in creative ways and moving our content and our ideas and our messages out onto the platforms that people are using, such as YouTube. Phone apps, I think, are important too. something also that we're working on, because we want to be out there. You know, that's where people are learning about things, and we want to be part of that. So part of our strategy is to build partnerships with networks, and building networks is my overarching theme here. We began with working directly with the Children's Environmental Health Network, which has helped us reach all of their audiences, and integrated our particular knowledge base and findings into a variety of content that they push out through their various channels. So I think that's been successful for us. We're also working with the Pediatric Environmental Health Specialty Unit in San Francisco and trying to link with that network. And next we're working on joining networks that work on healthy homes and products and some of the related disease outcomes. So there are lots of ways to do this. I'm sure a lot of people are doing this as well, but the power of networks, it can just expand your impact immediately beyond what you can reach yourself. And these are some images of some fish at school that I don't know if they'll resonate for you, but you know, I really think of trying to align what people are saying and what we're doing in ways that is clear and makes a compelling, much bigger picture that any of us could alone. So this is a little image that I like for that, and you can decide if that works for you or not. But we know that there are a number of issue networks, and this is a term that comes from political science, but they're networks of individuals, organizations, communities, sometimes institutions, that link diverse entities over time to try to achieve policy outcomes and other kinds of interventions that address some issue, that they're linked by the issues that they care about. And they're highly influential in many areas and have been successful in important topics in environmental health. I mean, smoking is an important example, but there are many others. And these linking up with these kind of networks can help us broaden our reach and also lengthen our impact over time. So we're trying to think about this in a fairly systematic way. So we're working with networks. We're also trying to actively engage in organizations that are at the science policy interface. And for us in California, the scientists in the California Environmental Protection Agency and the Office of Environmental Health Hazard Assessment, which does a lot of scientific development work in environmental health, are key. So we have a strategic relationship with them. We've been doing a symposium series on emerging research in children's environmental health. This year was our second year doing that. And so we had an event just last month about cumulative impacts in children's environmental health, because this is an active area of technical and policy development in California, how to deal with cumulative impacts. And yet the questions related to children's environmental health have not been foremost up to now. A lot of very important work has been done here. And so we thought it would be good to pull together some of our knowledge and findings in our research community and bring that forward in a way that could be brought into the policy and technical development now ongoing through the Office of Environmental Health Hazard Assessment. So we had the symposium where we filmed the talks to put up on video, and then we're working on the implications, you know, what are the next steps to move forward on some of this stuff. And the meeting objectives, which I'm only going to show you briefly and probably not long enough for you to read it, show that part of our specific goal here is to provide opportunities for engagement and reflection and action across these sectors. And so then next we get to engaging the policy actors themselves. California, like many states, is a very active venue for development of environmental health policy. And as we know, sometimes federal actions follow state actions. And so we did a legislative briefing after our event in Sacramento in January. And we're very cognizant of the importance of that audience. I wanted to mention very briefly an additional component of this is to try to identify more systematically what existing points of uptake are for our research. And I've listed some particular types of uptake or types of things that become integrated into these policy and intervention settings, and I've shown you an unreadable picture of one analysis that we did just to illustrate a little bit of what I'm talking about. But my main point here is that there's also a systematic part of this, and looking at how to package or portray or put together the things that we do in ways that fit into processes that exist. It's not to say those are adequate in every way, but there are some existing opportunities there. So my final point is I think we can build our strategies within our community, and we want to work with people who are interested in that to extend the great lessons from community-based participatory research in ways that perhaps can increase the duration for our engagement and some longevity for the implications of our findings, and to try to amplify our efforts to promote the public interest in a number of settings with regard to children, to really achieve the impacts at the scale needed to protect kids. So I thank you for your attention, and I appreciate the opportunity to participate here.
Thank you very much, Amy, for an excellent presentation.